Prevalence of adenomatous polyposis in a fecal immunochemical test-based colorectal cancer screening program and risk of advanced neoplasia during follow-up. Introduction. The definition of attenuated adenomatous polyposis has traditionally been based on the occurrence of 10 to 99 cumulative lifetime adenomas in the colorectum. This definition, regardless of family history, is known to cover a wide spectrum of situations, from patients with multiple sporadic adenomas to those with genetically inherited polyposis syndromes due to APC or MUTYH pathogenic germline variants. Current guidelines recommend that patients with 10 or more cumulative adenomatous colorectal polyps should receive genetic counseling, as well as intensive endoscopic surveillance in specialized colorectal cancer, CRC, high-risk units. Given the growing volume of screening colonoscopies and the increasing improvements in technology and polyp detection, more and more individuals are being diagnosed with multiple colorectal adenomas, representing a meaningful burden for high-risk clinics. The diagnostic yield of genetic testing in this population, especially in those with 10 to 19 adenomas, is very low. Moreover, in the setting of organized CRC screening programs aimed at individuals aged 50 years or older without a relevant family history of this neoplasia, the yield of germline genetic testing is likely to be even lower. With this in mind, Spanish guidelines for CRC diagnosis and prevention establish the lower limit for genetic testing as 20 lifetime adenomas, except in those cases diagnosed at a young age or where a family history of CRC or polyposis is documented. On the other hand, there is scarce information to support the efficacy of intensive surveillance in patients with non-hereditary attenuated adenomatous polyposis. Some of these patients may carry a low risk of metachronous neoplasia and are currently over-surveilled, representing a significant burden on endoscopy units. The prevalence of patients with 10 or more adenomas and the proportion of inherited polyposis syndromes in fecal immunochemical test FIT-based CRC screening programs remain unclear. More importantly, for those patients without a hereditary cause, the risk of metachronous neoplasia has been poorly described. Given the above-mentioned uncertainties, the aims of the current study were 1. To evaluate the prevalence of patients with 10 or more adenomas in a FIT-based CRC screening program, 2. To describe the prevalence of hereditary syndromes, and 3. To investigate the incidence of CRC and advanced neoplasia during follow-up of non-inherited cases. Methods. Carballal et al. Retrospectively included all FIT-positive participants with 10 or more adenomas at index colonoscopy between 2010 and 2018. Surveillance colonoscopies were collected until 2019. Patients with inherited syndromes, serrated polyposis syndrome, total colectomy, or lacking surveillance data were excluded. The cumulative incidence of CRC and advanced neoplasia were analyzed by Kaplan-Meier analysis. Risk factors for metachronous advanced neoplasia were investigated by multivariable logistic regression analysis. Results. 215 of 9,582 participants, 2.2%, had 10 or more adenomas. Germline genetic testing was performed in 92% of patients with 20 or more adenomas, identifying 2 inherited syndromes, 3.3%. The 3-year cumulative incidence of CRC and advanced neoplasia were 1% and 16% respectively. In 39 patients, 24.2%, no polyps were found on first surveillance colonoscopy. The presence of an advanced adenoma was independently associated with a higher risk of advanced neoplasia at first surveillance colonoscopy, odds ratio 3.91. Beyond the first surveillance colonoscopy, the risk of metachronous advanced neoplasia was lower. Conclusions. The prevalence of 10 or more adenomas in a FIT-based CRC screening program was 2.2%. A small proportion of inherited syndromes were detected, even among those with 20 or more adenomas. A low rate of post-colonoscopy CRC was observed, and the risk of advanced neoplasia beyond the first surveillance colonoscopy tended to progressively decrease throughout successive follow-ups.